today we're gonna learn about folliculitis. Folliculitis is a skin condition in which hair follicles become inflamed. A hair follicle is a structure in the outer layer of the skin. Hair starts growing at the bottom of hair follicle. Folliculitis is usually caused by a bacterial or fungal infection. At first, it may look like small red bumps or white-headed pimples around hair follicles. The infection can spread and turn into no-healing, crusty sores. Folliculitis signs and symptoms include clusters of small red bumps or white-headed pimples that develop around hair follicles, pus-filled blisters that break open and crust over, itchy burning skin, painful tender skin, a large swollen bump or mass. Make an appointment with your doctor if your signs and symptoms of folliculitis don't go away after a few days. You may need an antibiotic or an antifungal medication to help control the condition. There are two main types of folliculitis, the superficial and deep. The superficial type involves part of the follicle, and the deep type involves the entire follicle, and it is more severe. First type of superficial folliculitis is bacterial folliculitis. This common type is marked by itchy, white, pus-filled bumps. It occurs when hair follicles become infected with bacteria. Staph bacteria live on the skin all the time, but they generally cause problems only when they enter your body through a cut or other wound. Second type is hot tub folliculitis. With this type, you may develop a rash of red, round, itchy bumps 1 to 2 days after exposure to the bacteria that causes it. Hot tub folliculitis is caused by Pseudomonas bacteria, which is found in many places, including hot tubs and heated pools, in which the chlorine and pH levels aren't well regulated. Third type is razor bumps. This is a skin irritation caused by ingrown hairs. It mainly affects men with curly hair who shave too close and is most noticeably on the face and neck. People who get bikini waxes may develop barber's itch in the groin area. This condition may leave dark raised scars. And last type of superficial folliculitis is pityrosporous folliculitis. This type produces chronic red itchy pustules on the back and chest and sometimes in the neck, shoulders, upper arm and face. This type is caused by a yeast infection. Yeast is a microscopic fungus consisting of single oval cells that reproduce by budding and capable of converting sugar into alcohol and carbon dioxide. Types of deep folliculitis include Psychosis barbae. This type affects males who have begun to shave. Gram-negative folliculitis. This type sometimes develops if you're receiving long-term antibiotic therapy for acne, which is a skin condition characterized by red pimples on the skin, especially on the forehead due to inflamed or infected sebaceous glands and prevalent chiefly among adolescents. Boils and carbuncles. This occurs when hair follicles become deeply infected with staph bacteria. A boil usually appears suddenly as a painful pink or red bump. A carbuncle is a cluster of boils, a severe abscess or multiple boils in the skin, typically infected with Staphylococcus bacteria, a bacterium of a genus that includes many pathogenic kinds that cause pus formation, especially on the skin and mucous membranes. A pus is a thick yellowish or greenish opaque liquid in infected tissue, consisting of dead white blood cells and bacteria with tissue debris and serum, which is a protein. And eosinophilic folliculitis. Eosinophilic folliculitis. This type mainly affects people with HIV/AIDS. HIV is a virus that attacks the body's immune system and there is no cure for it. AIDS is a potentially life-threatening condition caused by HIV. Signs and symptoms include intense itching and recurring patches of bumps and pimples that form near hair follicles of the face and upper body. Once healed, the affected skin may be darker than your skin was previously occur. The cause of eosinophilic folliculitis isn't known. Folliculitis is most often caused by an infection of hair follicles with Staphylococcus aureus bacteria. Folliculitis may also be caused by viruses, fungi, and even an inflammation from ingrown hairs. Follicles are densest on your scalp, and they occur everywhere on your body except your palms, soles, lips, and mucous membranes. Anyone can develop folliculitis, but certain factors make you more susceptible to the condition, including having a medical condition that reduces your resistance to infection, such as diabetes, chronic leukemia, and HIV/AIDS, having acne or dermatitis, taking some medications such as steroid creams or long-term antibiotic therapy for acne, being a male with curly hair who shaves regularly, wearing clothing that traps heat and sweat, such as rubber gloves or high boots, soaking in a hot tub that's not maintained well, causing damage to hair follicles by shaving, waxing, or wearing tight clothing. Possible complications of folliculitis include recurrent or spreading infection, boils under the skin, permanent skin damage such as scarring or dark spots, destruction of hair follicles, and permanent hair loss. You can try to prevent follicles from coming back with these tips. Avoid tight clothes. It helps to reduce friction between your skin and clothing. Dry out your rubber gloves between uses. If you wear rubber gloves regularly, after each use, turn them inside out. Rinse with soap and water and dry thoroughly. Avoid shaving, if possible. For men with razor bumps, growing a beard may be a good option if you don't need a clean shaven face. Shave with care. If you shave, adopt habits such as the following to help control symptoms by reducing the closeness of the shave and the risk of damaging your skin. Shaving less frequently. Washing your skin with warm water and antibacterial soap before shaving. Using a washcloth of cleansing pad in gentle circular motion to raise embedded hairs before shaving. Applying a good amount of shaving lotion before shaving. Shaving in the direction of hair growth though the study found that men who shaved against the groin had fewer skin bumps. See what works best for you. Avoiding shaving too close by using an electric razor or guarded blade and by not stretching the skin. Using a sharp blade and rinsing it with warm water after each stroke. Applying moisturizing lotion after you shave. Avoiding the sharing of razors, towels, and washcloths. Considering hair removing products or other methods of hair removal, though they too may irritate the skin. Use only clean hot tubs and heated pools, and if you own a hot tub or heated pool, clean regularly and add chlorine as recommended. Talk with your doctor depending on your situation and frequency of recurrences. Your doctor may suggest controlling bacterial growth in your nose with a 5-day regimen of antibacterial ointment and using a body wash with chlorhexide. Thanks for listening, and this is the end of the presentation.